Let's talk about fertility preservation. So, what is fertility preservation and who needs fertility preservation treatment? That is very important. If we know beforehand, then you can utilize this. So, for male semen or sperm preservation, why it is done? Usually male fertility, we say it's a long time, male after puberty, and there is no andropause as such, but definitely within the age of 45 the best quality sperm we get. After that also we will get sperm, the quality decline with age. So, why male need to preserve their fertility, if why and when? So, for this, it is a typical indication is if somebody is suffering from some disease, especially cancer or something related to it, where you need a chemotherapy, radiotherapy or orchidectomy, that is the your end of your reproductive life, then you need to preserve sperm beforehand, before you undergo this sort of treatment which can damage your testis, or testis is removed because orchidectomy is being done because of a tumor. So, in those cases sperm need to be preserved, otherwise male fertility is a long time. So, usually we do not preserve this for fertility purpose. People can freeze their sperm for different reasons. Somebody is not here, they want their wife to get pregnant with the sperm kept in our liquid nitrogen, that is different, that is sperm freezing. And preservation, cryopreservation is done basically due to this reason. But for female, this is even more important. If there is of course cancer, the same applicable for female, a young female, reproductive age, and some unfortunate event like any cancer in any part of the body, which, and especially ovary or in a reproductive organ. So, definitely that needs either surgery or chemotherapy or radiotherapy, which will damage your reproductive potential. In those cases fertility preservation is important. But other reason, if in a healthy female where you can do fertility preservation, because our female infertility is it's a very time dependent. So, we have got a reproductive lifespan of few years, and after 30 our egg quality declines, and after 40 there is a sharp decline and we undergo menopause, or there is end of our reproductive life 40 to 50. At that time many women undergo menopause. So, before menopause, I think 5 to 10 years before menopause, our egg quality becomes poor, and that egg sometimes is not good enough to produce normal healthy pregnancy. So, that is the reason that social cryopreservation, social preservation, fertility preservation things are coming now, because women are getting educated, their ambition is there, they are doing very good in their, they are doing their work very passionately, very good about their work. So, they do not have that time to think about family, or even if they are married, or they are not that time will be able to spend time, and that is why they are not keen for their family, or somebody not got their right person to get married. So, these are the reason when you think that because there is a reproductive lifespan, so if you are not able to reproduce that time, but you want your own biological child, that is the reason you should do your this fertility preservation procedure. It is but when you are going to do it, the problem is when we get this fertility preservation request, those women are quite elderly. So, because they are quite established in their life, that time they think, okay, we will do it because I do not have the right partner to get pregnant. So, in that cases, when they are coming in the 38, 39, 40, that time number of egg is less and quality of egg is poor. Though we can do fertility preservation, it is just like an IVF procedure. We stimulate your ovary with hormone injection, collect your eggs and keep it in the freezer so that we can use it in later purpose. But the process when a single egg is frozen, there is no guarantee that 100% recovery is possible from that. So if I preserve 5 eggs, I cannot guarantee you I will recover those 5 eggs as it is for pregnancy. So it can happen that 70% recovery or 60% recovery. That means if we are in first place we get less number of egg like 5, 6 and or 2, 3, then if we cannot recover all, then chance of pregnancy will be less. But if we do it at the younger age, when your number of egg is quality wise good and your number of egg is more, in that case if you do a fertility preservation, in that case we will get many eggs. Like if I can preserve somebody's 10-15 eggs, of course chance of pregnancy will be high, because if I lose 5 eggs also, then I'll also out of 15 I have got 10 eggs to fertilize, or I have got a good 7 eggs to fertilize if I lose 5 eggs out of 10 or out of 12. It's just a rough estimation. So because the recovery rate is not 100% and the aging egg will perform poorly, so if you have to do fertility preservation because you do not have time for reproduction now, it is not your priority, then you have to make a plan beforehand, so that when your egg number is good, you are young, that time if you do preservation, that will be more helpful for your reproduction. But problem is that time young age, the female, that time they are just not thinking about that, they do not have the awareness, they just think okay, I will get somebody, the man who, and I will, it's just normal, like pregnancy is just nothing, will produce. But the problem is that time economical independence is also not there. If somebody is young, they are going to college, so they cannot think of these things that time, at that point of life. But that woman, when she is economically independent, doing good job, still not getting married or not planning pregnancy, that time they start thinking. But if it is your after 35, the chance of good number of egg preservation is not always as you think. In some special women who are very fertile, for them probably will get good number of eggs, but who are not that fertile, for them the number of eggs will be less and the chance of success for the procedure will be less. So just to keep in mind, if you have to do it in time. So how do you choose the time? At least take an opinion of an infertility specialist, so that some basic test could be done, and the estimation how many eggs do you have and what would be the success rate, that you can at least have an estimation. Then you can think when or which year or at what age you are going to do it.